program is proving just the trick for patients. Nepean Hospital in Western Sydney is using the power of magic to help patients heal.
Project Magic is a therapy and rehabilitation program originally created by world-famous illusionist David Copperfield. Now running in 30 countries, it helps make a difficult time for patients a lot more enjoyable.
Half of the rehab is having fun. The physical stuff everybody has to do, but to have fun and help you to enjoy it just helps you get through it a lot quicker and a lot better.
Now, Dr. Adrian Sheen is a Penrith GP and Sydney Uni lecturer, and he joins us now. Good morning, Adrian.
Good to be here, thank you.
Talk us through how Project Magic works.
Well, Project Magic is a therapy. It uses magical tricks and magical ideas and magical movements just to make rehabilitation more fun for patients.
A part of why you think this is successful is that the patients that are doing it feel as if they're learning something that other people aren't. Is that right?
Yeah, it raises their self-esteem. It gives them it's a wow factor for their friends. They can do something. I mean, if you take a rubber band and put it on your fingers there, you put it on your fingers and you can put it there, and you can have it there, and then you can actually open your hands, and the rubber band actually can jump across to the other hand.
Can you do that again?
Well, I can do it. Let me make it a little bit more difficult. You see, this is a bit tricky now. You see,
it's like
you've got a rubber band here now, and you've got it. Then you've got it locked in. But you move it back, and it actually goes back to the other hand. Now, that's actually a very simple trick. It's just really about hand movement, and you're moving your hand and putting your hand into the rubber band. You're putting your hand there and out. But that's much more fun than being told to keep opening and closing your hand.
Sure. Absolutely. And while you were doing that, my mind was on nothing else except for what you were doing.
You were thinking about how to do the magic trick.
How was he doing it? Exactly.
And not about rehabilitation. So it makes it more. It makes it great. And I think that we've been very lucky. We've had Jack Daniels, who's one of Australia's really great magicians, coming out and give freely of his time to us at Nepean Hospital to do this. It's been exciting, and the patients really like it as well.
And you'd like to see it in other hospitals, right?
We would like, I think anywhere, any place that has rehabilitation, hospitals or even nursing homes, anywhere where people may be able to improve their rehabilitation, it could be used. I mean, Project Magic is a wonderful project. It's fun, it brings happiness and laughter to people, and laughter's the best medicine, as you know.
Yeah. Well, Patch Adams, that's of course what Patch Adams did, right?
Yes.
Was used humour to heal people. What reaction do you see from patients? What's it doing for them?
Oh, it's exciting, because they suddenly realise that their therapy session is more enjoyable. I think importantly as well, the therapists too enjoy doing it, because they've got something else to offer to patients there, and it raises the morale of the whole environment there.
Does it actually help their rehabilitation? I mean, for the health benefits of it, not only is their mind...
You have to think hard when you're doing magic.
Yeah, right.
It could go wrong. But there are. I mean, David Copperfield wrote a whole book on Project Magic, and there's a whole book about tricks there and what the health benefit to this book is, to the patient is, and where you should use certain tricks. So that it's really fantastic.
So are there enough magicians around the place to go to every hospital?
Well, we can try and I hope there will be, because magic's a wonderful wonderful interaction with patients. You can use it so often and in many situations. There are several doctors that use magic in their surgeries. It's a great communication tool to be with any patient, actually, but particularly young children love to do a quick trick in the surgery.
So how did you get involved? Sorry,
that's what I was going to ask.
How did you get involved? Were you just on a street corner with a hat?
Well, I think I just sort of enjoyed. I think I enjoyed the interaction, the entertainment you get from it. But you really enjoy the reaction you get from people when they say, I know how you do that. But in fact, they really don't quite know how you do that. And
I don't know how you did that.
No.
Check your fingers at it.
As a doctor, would you start your consultation with some magic?
With a trick? Well, you've got to be slightly subtle about this, but you might try and engage children with the magic trick. But so if you don't know what's going on, you can say, well, look, let's try a trick instead. You see, it might help.
Are some people reluctant to it, perhaps, particularly if they're in rehabilitation, they might be mentally just not feeling like they want to engage in something?
Well, that's the whole trick. That's the whole point of Project Magic. It does allow people to engage, to communicate. It's not much fun being in rehabilitation. It's not much fun having to go to hospitals and being told what to do all the time. But this provides some sort of joy and happiness to their life, and even in a small way. I think it improves their self-esteem, it empowers them, it gives them something they can do which other people can't.
And do you give away any of the secrets? Do you tell them how you moved your fingers and the rubber band's actually got a hold of them?
They're all top secret, everything, yes.
Your advice to people at home that might have a loved one that is in pain or recovering from something, do they just go ahead and start just YouTube, you know, how to perform?
Yeah, I think keep it very simple. Keep it very simple. There's tons of stuff on YouTube, but if you just keep it very simple, just do things that work, and enjoy when it goes wrong. If it fails, well, don't worry about it. Just have fun and have a good laugh.
I love it. How fantastic to
Adrian.
talk to you. Thank you so much for coming in, and best of luck with it.
Thanks.
Pleasure to be here. Thank you so much.
Terrific.